Mitral valve regurgitation is the most common valvular heart disease, which may lead to life-threatening complications such as heart failure. To date, mitral valve regurgitation occurs in about 2% of the population. In the US and EU alone, over 4 million people suffer from moderate to severe MR. Incidence is increasing rapidly due to increase in life expectancy. Primary MR is caused by abnormalities of the valve components, such as chordal rupture and leaflet prolapse, and can cause bad coaptation between the leaflets that cause leakage. Secondary MR is caused by cardiac diseases leading to the left ventricle remodeling, which prevents proper coaptation of the leaflets. The VLR system offers a combination of valve posterior leaflet repair and annuloplasty in one device. The VLR solution is based on the gold standard surgical mitral valve repair approach. The VLR treatment is applicable for 95% of MR patients. During implantation, a transseptal approach is used to ensure the VLR device is properly deployed, aligned, and positioned above the mitral valve leaflets with echo guidance. Once placed, the posterior part of the VLR implant prevents prolapse and leaflet flailing while restoring coaptation and native valve function and instantly preventing leakage. A unique attachment tool and a super elastic coupling element anchor the implant to the leaflets at several locations to prevent misalignment and migration. VLR restores leaflet coaptation, which enables the native valve to function with adequate blood output without MR. Over time, the VLR device will be surrounded by tissue ingrowth and become an inherent part of the mitral valve. The VLR device becomes part of the native mitral annulus, preventing any late dilation.